So what we're going to do is we're going to go through the various hormone feedback loops that we did not get a chance to go through by the end of class on Wednesday. So we're going to start. So now let's take a look at the non-glandular tissue coming from the immune cells, liver, gastrointestinal tissues, cardiovascular tissues, adipose tissues, the renals. This is a non-exhaustive list. Coming from liver, we have things like hepatic growth factor, HGF, insulin-like growth factor, IGF. Coming from adipose tissue, we have hormones such as TNF-alpha, leptin, adipocin, RBP4, adiponectin. Coming from the immune cells, we have all of the various interleukins, the ILs. Coming from bone and from muscle, we have IGF, insulin-like growth factor, MGF, mechanic growth factor, things known as MIFs, muscle ischemic factors. Coming from the kidneys, we have a hormone known as EPO, erythropoietin, and we've already talked about renin. Coming from the gut, we have things like CCK, ghrelin, and a little bit of leptin. So let's take a look at EPO. EPO is a regulatory hormone that is going to ensure that we have the correct level of oxygen saturation within the bloodstream. When we have low oxygen tension detected within the kidneys, or low oxygen saturation detected within the kidneys without high levels of lactic acid, we get a stimulation of EPO production and release within the extraglomerular cells. These head into circulation and stimulate mitosis of bone marrow cells, leading to the proliferation and differentiation of progenitor cells into what are referred to as CFU erythrocytes. If the CFU erythrocytes get continual secretion and get continual exposure to EPO, they will undergo a maturation into mature erythrocytes. These mature erythrocytes will then head into circulation, causing an increase in O2 carrying capacity in order to inhibit those low O2 tensions. We'll talk a little bit more about this when we talk about blood in the cardiovascular system. The next few that we're going to look at are all about energy regulation and immune function. The first one we're going to look at is adiponectin. Adiponectin is released in large concentration when we have large amounts of lipolysis. This large amount of lipolysis and the increase of adiponectin causes a change in macrophage activity, a normalization of insulin actions, as well as a normalization of energy and energetics at the peripheral tissues, the liver, the skeletal muscle, as well as additional changes within the adipose tissue itself. Additionally, it's going to have an effect on the cardiovascular system, leading to what's referred to as arterial compliance and cardiac function, and it's going to have a diminishment of atherosclerosis as well as left ventricular hypertrophication. The change in the cardiovascular function is going to increase work capacity, whereas the change in energetics is going to end up having a normalization on what's referred to as metabolic flexibility. Leptin is once again released from adipose tissue. However, it's released in the opposite to what adiponectin is released with. Leptin is released in lower concentrations when we have large amounts of lipolysis and large amounts of fat metabolism within the adipose tissue. When we have this occurring with stimulus that diminishes a secondary signal known as AMPA, what we end up doing is we end up getting a change in the food intake signaling as well as a change in the hypothalamic pituitary gonadal functions, leading to an increase of LH and an increase of testosterone and a normalization of gonadal functions, something that we'll get to when we talk about some of the reproductive issues. This change from the hypothalamus and the pituitary is going to end up increasing growth as well as thyroid stimulating hormone. The increase of growth hormone is going to cause an increase of IGF, HGF, MGF at the liver as well as within the skeletal muscle tissue. Active skeletal muscle tissue will also increase MGF. TSH will head to the thyroid and increase the release of thyroid hormones, T3 and T4. Leptin will also go directly to the pancreas as well as directly to the liver, causing a normalization of glucose metabolism and insulin functioning. It's going to have a normalization of anabolic responses at the tissues and an increase of lipolysis within fat droplets within those tissues, leading to, once again, that normalization of metabolic flexibility. Leptin also heads to the hypothalamus pituitary and it changes the stress response. We get a diminishment of the sympathetic nervous system. We get a diminishment of cortisol. We also get a reduction in macrophage activity. All of that causes a change in the immune response, leading to a change in cardiovascular function and an increase of work capacity. Now there's a different signal that comes about with leptin when we use endurance as opposed to resistance exercise here, and it has to do with that change in AMPK. Where that change of AMPK will change the food intake and everything else except a change in the gonad functions. Leptin is also going to be involved with the overall energy balance and regulation of basal metabolic rate with another hormone known as ghrelin. And it works in an antagonistic fashion, regulating the oryx areas of the brain, the area where you need to have food because you happen to have a negative energy balance, versus the anorexic areas of the brain, which is where you don't need food because you have a positive energy balance. Based off of the stimulation of the oryx areas and the anorex areas, we're going to get a change in the pituitary release of growth hormone and TSH. The change of growth hormone and the change of TSH is going to affect the basal metabolic rate and the aerobic metabolic processes of the body. Where when we have ghrelin in large concentrations, we generally have a stimulation for growth. Whereas when we have a diminished level of, or a reduced level of, we end up having lipolytic activities and a reduced amount of growth. Next, we're going to head and talk a little bit about stress before we get back into the regular lecture on Wednesday.